special request.
Welcome Madam Elizabeth Oyuel. She likes a song that is called Sweet Elizabeth.
Sweet Elizabeth.
Hebu muonyeshe kidogo anapokuja.
Sweet Elizabeth.
Hey, my lovely Elizabeth.
Sweet Elizabeth.
Hapo sawa. Elizabeth, uko wapi mami? Ewa ya. Hey. Aleki from Siaya mama. Hapo sawa. Hey. Shikilia hapo DJ. Hapo sawa. Wachi hapo. Anachoka haraka.
C'est passionné mon cœur. Elisabeth, maman, mon libre maman. C'est Elisabeth. Elisabeth, maman. Libre maman, la gâte les roches, libre, maman, quanticate. Libre maman, c'était la paix, parayoka. Libre maman, la gâte les roches, libre, para quanticate. Libre maman, la gâte les roches, c'était la paix, parayoka.
Yo Elizabeth, sema iwai.
Thank you so much, my son-in-law. I still have one daughter. Bado niko na msichana mmoja mrembo kama mimi. Now, we are here to celebrate a very special group, and I'm lucky that I belong to that group. And I just want to say that God is good, and all the time. Wow. Because many people who are in September 77 class are in this hall. Those who are not here physically are represented heavily by their person. I don't want to be here. Now this looks a bit funny. We will remove our view when you are coming to speak, so that we do other things. So I want to recognize all of us who are in the hall. Thank you for coming. Thank you for yielding to our call. We made a passionate call, like Fred said during the opening ceremony, and we were calling one by one. There were 100 people on the list of those who joined ECSACON between 1990 and 2010. So we have to go through their 100 names. Fred took 50, I took 50, and it is calling. Dr. Kireni, are you still there? Are you well, Mom? Then she wrote me a very beautiful message that she really would have loved to be here, but her knees have refused. So now that my knees, they have accepted, see we dance. Pakistan, go on our upper extremities, but relax. So we thank God. Mrs. Ngure, Dr. Kireni was our first African Chief Nursing Officer, so she's unwell. Then the second African Chief Nursing Officer, Mrs. Duori, just had a surgery last week. She couldn't come. Remember, I'm speaking to my compatriots, the directors of nursing, those ones. The third African Chief Nursing Officer, Mrs. Ngure, had an open heart surgery 2 weeks ago. So again, she was not able to come. Who was the fourth? Is it Mrs. Waudo? Or Kandie? Kandie, I called, she's not able to speak, and Kandie can never not pick my phone. So Nakuru people, kindly visit Mrs. Kandie on my behalf. I was an IPA, and we worked very well. ECSACON took us to Zimbabwe. We presented papers. Those days, we didn't even know how to do PowerPoint. You are with me in Zimbabwe. I tell you, we didn't know how to do PowerPoint, so somebody did for us slides which we were taking through very quickly. Before I finished, she had finished. So we come from far. She's my mother, I'm her daughter. So please visit her on my behalf and just give her big hugs. The next Chief Nursing Officer African was Mrs. Agnes Waudo. She had a program, she still works for Emory University, the people who computerized the Nursing Council. So she still works, she has a program which she couldn't delegate. The next one, Mr. Akwo, is in Kisumu. He was not able to travel and he didn't come. Susan Otieno is the next. She has 2 family members who are sick. One is critical, the other one is a bit better now. Now the next Director of Nursing is Mrs. Elizabeth Oliver, and she's here. Wow. That is where the story was ending. So it's to thank God that we are here, and I'm representing all those that I've talked about. Let's go to the registrars. The first African was Mrs. Mujomba. Mrs. Mujomba was teaching us in 77. You remember her? Rose, where are you? Remember Mrs. Mujomba? She passed on. Then Kanaya also passed on, like 2 years ago. Mujomba, went to be with the Lord earlier than Kanaya. Then we had Mwamuye. She has gone a little quiet. So if somebody meets her, please tell her we still need her, we love her. She worked so hard for us. In the middle, there was Jacqueline Murithi, who signed my certificate. She also rested like 2 years ago. Her husband rested last year, a year after. And so the next one after Mwamuye is Elizabeth Mzee. And I'm here. Wow. There's so many reasons to thank the Lord, and we just want to say we are glad to be here, and we're glad to be part of ECSACON. So 1990 to 2010, great people are in the house. Some of them I will forget. If I miss you, please just lift your arm and say, you have been forgotten. The first one, former chair of the Nursing Council of Kenya, a great educator, Moi University. Benson Magera is in the house, the oldest in the house, and the sharpest, oldest and sharpest, Mr. Constitution himself. The next one, Mrs. Mai, the mouthiest, the mouthiest. She took the DMS's head on. Dr. Muga of Homa Bay, I think, remembers you with a passion, So Mrs. Mai is still an educator at Moi University, and she has taught many midwives, and she continues to teach. She's about to retire, I believe, and when she does, she's leaving the profession to very good people like Lady Dulo, who are talking about PPH with a passion. Take over from Mrs. Mai.
I will.
Perfect, very nice. My own classmate, Rosa Montani, we went to school the same time, went to class in Marwaroyo's class, then went for advanced nursing the same day. We finished, she went private to Nairobi Hospital, I remained in government and grew. So government is also very good. Actually, government is the best. Let me tell you here. Government is mzuri kabisa. Then, Grace Omulogoli, my other classmate, Dr. Wawaroyo, she went through, she remained in Kenyatta, I went to Tagatanga Kidogo, came back to Nairobi, taught, and did many things. So Grace is in the house. Thank you so much, Grace, for coming. September 27 class. Next to them is Henrietta Amati, an educator. It's been introduced many times here. Henrietta worked in the Nursing Council in the analog era, in the education department. She did very well. She did very, very well. Henrietta. That table is finished. The rest, Otieki is a young one. I will not mention. Let me come to that. Let me come to this table. There's Truti. Truti, have you heard somebody called Truti? She's the one. Munyendo. Munyendo was a board member of the Nursing Council of Kenya during my tenure, representing mental health nurses. She's a good practitioner. They have been in ECSACON, come rain, come sun. When everybody else in Mathare were not coming, there were just three. Munyendo, Salome, and Beatrice Abomu. Those three are the foundation of ECSACON in Mathare. Thank you so much. The nurse of the President, Jomo Kenyatta, is in the house. Isabel Waweru. That one. She's still as young as she was in 1963. When we finish, please ask her what she's doing to make her history. Thank you, Mark, for coming. Then we have Jacqueline. Jacqueline was a teacher at ECSACON the last time we spoke. And then she went Sunday. Today we have Sida. Thank you, Nakuru, for looking for Jacqueline, and she's here. I believe this is Dr. Mugo. I believe that's Dr. Mugo. Thank you, sir, for looking after her. Very well. Very well. You see? Hey, marriage works. Who says it doesn't? It works. Then I move to that table. Then we have another one also from our class. We graduated with her. She's in Machakos but used to be the chief nurse for Kenyatta National Hospital, Rosemary Mutua, in the house. Thank you so much. She has retired nicely in a nice farm in Machakos, surrounded by fruits. That's why she looks younger than me. Then we have the beautiful, the bright, the tallest, everything, Lydia Musumi. If you are a theater nurse and you do not know Lydia, then you just passed through theater. You did not go inside. That's the one. Lydia is heading a hospital in Nairobi, Nairobi South Hospital. So we are places, we go places, we go very far. Next to Lydia, we have Winnie Alonda, the pilot herself. Winnie has taken us to Swaziland twice. She has taken us to Zimbabwe twice. She has taken us, where have we gone? If I start counting, I'm not finished. So Alonda is Alonda of Crane Travels. So those who are going to Eswatini will be connecting with Winnie to fly us to Eswatini. Then Betty Obutu will take us from Johannesburg to Manzini. We are in safe hands. The other pilot has been promoted. The Reba has been promoted, so she will not take us this time. That brings me to the end of this group, of that generation. We are saying we are almost going. When we go, we have left the profession in very safe hands. Personally, I'm retiring tomorrow as the treasurer of ECSACON. So next time you see me on stage, I'll be here on consultancy basis, on USAID base, at a fee. So ECSACON look for money because I'm expensive, very expensive. So I saved the best for the last, the best for the last. We have in the house the CEO of Aga Khan Hospital, Kisumu, Jane Wanyama, is in the house. Please stand. Jane will be speaking to us just about nursing. For a few minutes, we'll give us space. So that is Jane. Jane has been in Aga Khan, Nairobi for many years before she went to Kisumu. And Aga Khan, Nairobi is my home. I used to walk in, walk out. If they want a teacher, they call me. If they want somebody to speak, they call me because I can speak from morning to evening. See, I told you I went to advanced nursing with the Rose Hotel. I was taught how to teach. So I can speak. Yes, but today I'm not going to speak a lot because I know we need to go and sleep and we need to dance before we sleep. We've only danced Elizabeth, we need to dance all these people. And by 11 we are done. Thank you so much. I don't want to end before I say I saw Elder Nyongesa came. Elder Nyongesa came when we had finished the opening ceremony. Chair of KPNA, kindly stand so that they see you. KPNA is going places. They have applied to join ECSACON. They have applied to join ICN. And by God's grace, KPNA will be in those two bodies in my lifetime. Thank you so much. Then I saw Collins. I'm seeing his colleagues, but I'm not seeing him again. Maybe he walked out. Our president for NNK is not there. So he was here. So those are the VIPs for tonight. Our chief guest has not arrived. I believe she's still powdering her nose. When she comes, we will be able to acknowledge her. Thank you so much, Caro Adwera, who is my tourmate.
Thank you, Madam Elizabeth. You've all heard that she's retiring tomorrow, so the whole night you have time to campaign for the treasurer, ECSACON, because she has put it in black and white. Thank you, Elizabeth, for that. We'll continue. We have our key partners with us here. Mr. James Oyeko, are you there? James Oyeko from USAID. You're welcome. Any representative from USAID? Oh, Will you talk on his behalf? Okay, James is not with us here. Anybody from USAID? The next is Dr. Monica Ogutu from KMET. Any representative? I know she's not around, but there are representatives from, yes. USAID? Karibu, sorry. I'll call you later, just relax. Karibu sana, welcome.
Good evening. I trust you're well, and I thank you so much. I'm also Eliza, so I think we'll continue with the dance on a lighter note. Thank you so much. I take this opportunity to thank and honor the people who are before us. They set the pace for us. Those of us who came a bit later in the profession got to hear so many challenges, so many stressful situations that you guys went through to make it the way we found it. We really and truly appreciate you. Were it not for you, we wouldn't be proud to be associated with nursing. As we could hear those days, things were not easy. But we thank God today, we can stand and say we are professional nurses, just like any other professional would stand here and say, I'm a lawyer by profession, I'm so and so. So I thank you very much, and I'm proud to be associated with you. And I would wish and urge the nurses who are younger than us as well. I think we're in different cohorts. I wish and urge you to excel. Go academic, go higher and higher, and let's place our profession at a level where everyone would wish to be a nurse. Even those of us, those of our colleagues who are our cohorts would envy to change to be nurses. We've had several who tell us as we speak now, they say, I wish I'm a nurse, I would have gotten avenues. Now I'm restricted, I'm held, I can't. But if only I was a nurse, I would have a difference. So we are truly appreciating your efforts. So on behalf of USAID Tujenge Jamii, as earlier we had talked about it during the day, USAID Tujenge Jamii is a USAID funded program, a 5-year funded program in 4 counties in Kenya. We support RMNCH in Nakuru County and health system strengthening as a chief project. We also support other 3 counties, Samburu, Baringo, and Laikipia on HIV programming. But in Nakuru, we are privileged to support both integrated programming, HIV, and RMNCH. So as we work together, we are grateful to be part of this conference, and we look forward to support more and more. And we wish you all the best as we enjoy the evening. Be blessed, and as you go back to your places, just know that USAID Tujenge Jamii, on behalf of the USAID, is really wishing and willing to support the Kenyan community to change the narrative, especially on maternal and child health, because you know that is where the thorn is. Losing a mother to maternal mortality is equivalent to losing a whole bus in a crash. Get that concept? So as you go, whatever you do, whatever you say, think of that one life, that one number. Behind that number is a human life lost, and behind that human life lost is a multitude of ripple effects. So please, as you go, as you work, as you teach, as you do everything, at the back of your mind, have in mind that one number. Behind that one number is a human life. Otherwise, we wish you all the best, and God bless you.
Let us give a round of applause, a better one. Thank you very much, USAID. Let us all join USAID so that we support our country and our mothers at large. At this time, I want to call KMET, representative of Dr. Monica. Karibu sana. Let us give her a clap as she comes.
Good evening, ladies and gentlemen. Good evening once again. Yes, on behalf of KMET, for those of us who do not know KMET, KMET is the Kisumu Medical and Education Trust under the stewardship of Dr. Monica Ogutu. And Monica Ogutu is also a midwife, and I love the fact that even though myself I'm not a midwife, but under her stewardship, she has really taught me to come to enjoy the profession. So I always tell myself that I'm a midwife by extension, and I always also love to work and engage with the midwives in the house. So as KMET, we have been working with a lot of the professional bodies, ICF being one of them, the Nursing Council and the Midwives Association of Kenya. And as I said earlier, we are having our commitments and to work with the professional bodies to promote safe motherhood. And as KMET, we have committed to also partner with ECSACON as one of the bodies to also work and ensure that the nurses and the midwives can actually advance or promote their objectives. And I know one of the things that Dr. Monica is very passionate about is advocacy, and she's also part of the PUSH movement, and she has always been talking about nurses rising up, so that you are in charge of research, you are in charge in terms of advocacy, and you are in charge of promoting or having a voice or speaking in behalf of the midwives in the nation and of course globally. So as KMET, once again, we are ready to support, we are ready to work with the teams to ensure that nurses' voices are heard, and not only globally, but also locally, even as we try and promote safe motherhood. So on behalf of the team, thank you again for giving us the opportunity to be here, and we hope to continue with this partnership. Thank you.
Thank you, KMET. Thank you very much. That clap is not enough. A big clap for KMET. They are our partners. They are one of the key partners with us. This point in time, I want to call the PAN Pharmaceutical. Is there a representative from PAN Pharmaceutical? Yes, welcome, welcome, welcome. Karibu sana. Tumpigie makofi anapokuja. Karibu, karibu, karibu sana. Asante.
I deem it as a privilege before in front of you, ladies and gentlemen. Good evening. Thank you for giving us the platform to giving an introduction stage of our innovative product. We are here to surprise you more with our products. It is really helpful in the wound care industry as well midwife, surgical, those areas. We are here tomorrow, and we need your continued support, and we need your whole platform. We really appreciate your welcoming this platform. Thank you.
Thank you, Pharmaceutical, a big hand for them. Asante sana.
Yeah, so this is a very special evening for us as ECSACON Kenya chapter. And as Elizabeth said, we made frantic efforts. I think Safaricom must have really wondered, what is up? Some numbers that have never been called for a very long time. We called them. And I remember when I called Mr. Benson, he said, Frederick, what do you mean? Coming to Nakuru? Now, where is the money? That was problem number one. And then number two, I can no longer drive. And then number three, I don't go far away these days. And I had ready answers. I told him, Mzee, you can't talk of money. You only need to do, touch some buttons here and there, and money will come. And true, I think money came, and he's here. I told him, from Eldoret to Nakuru, you don't need to drive. It is a well-serviced road. You can sit in a shuttle, you can sit in a bus. And I think there's a train now, the MTR. Although it takes longer to arrive, but you'll be Nakuru. So we are very happy and we are very proud of you. We celebrate you, and we look forward into the future when such forums come. Let money never be a limiting factor. I think the only limiting thing should be that your health can't allow you. Esther Kirabu, she sent her greetings. And she said, Frederick, my heart is in Nakuru, but my body has refused. It is not body. And Pauline Muhoho and Elizabeth explained the others, so I don't want to go into it. And this is the face of ECSACON. As a young nurse who had just joined the profession, I envied them, because to be an ECSACON member, those of us who remember, isn't it? It was not just a walk in the park. You must have been cooked, and you must have been tried, you must have been tested. It was not guesswork. You really had to know that you are joining a very serious college, a very distinguished college. So those of us who are young and who joined this college, please be proud of yourself, because this is a college with a distinction. And as I said during the opening ceremony, very soon, God helping us, will have people after your name. There will be an initial, the fellow of ECSACON. We were the first college, and the founding members remember this. And the vision was to be able to bring nurses and midwives within the region who would speak authoritatively on matters nursing and midwifery. But something happened. And the surgeons came and they began their college. And now they are producing, surgeons in specialties and subspecialties in their numbers. And Kenya is leading. Last week I was in Arusha, and we visited 2 sites where they are doing the collegiate program. KCMC, that is Kilimanjaro Christian Medical Center. It is in Moshi. And we also visited the Lutheran Medical Center, where they train the surgeons. KCMC, they do anesthesia, and they also do critical care. They do nurse anesthesia, and it is all through online. And they have those places where they go for practicals, which has been assessed. The physicians have joined, the anesthesiologists have joined, the ops gynae, they have joined, and they are producing in numbers. And we said we must begin. And now we have attracted a number of partners who would want to work with us. The Royal College of Surgeons in Ireland, because they are supporting surgeons. And as we all know, if you walk in a theater room, and Lydia knows this, if a trained theater nurse is not there, the surgeon will actually make a lot of noise. And for a long time, we've been doing business in a parallel way. But I think people now are realizing that partnership, collaboration, and working together in a team approach, you yield more results and you achieve a lot within a short time. So they are ready to train nurses in 3 areas. Number 1, operating theater nurses. Number 2, critical care nurses. And number 3, nurse anesthesia. And I think as a country, we must position ourselves. Private institutions, government or public institutions that are already accredited as teaching hospitals. And we will be having a discussion with the regulatory bodies because we have a buy-in. You do a program and it has to be acceptable, you can be registrable, and you can be able to practice. So this is what the college is thinking about. The other area that the college is thinking about is in the area of what Pamela spoke about, and this is knowledge management. I think AMREF has spoken about this so much. Those of us who went to Arusha last year, Diana from AMREF, who is the director of ICD, Institute of Continuing Capacity Development, she said in an assessment they did, they realized that as nurses we interact with a lot of information. So one of the challenges that we suffer is information overload. True or false? From the histories that we take of our clients, listening to challenges and issues when you report in the day, by the time you go home, you don't want to listen to anything else. Isn't it? So we suffer from information overload. The other challenge, which is the reverse of the same, is information underload. Those of us in far remote, far-flung areas where you are the one on call 24/7, you have no time even to look at an SMS. People send you messages, you respond to them a week later because you are so busy. You don't even read the newspaper. You don't see what happens on Twitter. You have no time even to see news. When people are talking about the current news, you wonder, what are you talking about? I didn't hear, I didn't see. My medical superintendent used to say, Dr. Misori, that if you want to hide very good information, put it on a notice board, because nobody will read. Unless you give somebody to begin it as a rumor, because it spreads like bushfire. So under knowledge management, and AMREF has come on board, we have an MOU which we have signed, and they are going to build capacity in terms of how do we process information that is user-friendly, that is going to be relevant in our practice, that is going to help us give better health care. Are we together? And I think this has been, it's been part of what we had in the morning about how to repackage information and be able to cut it across, pass it across. So this is what ECSACON College is for, and this is what we see in the future.
Keynote address from Ms. Jane Kisa from Aga Khan, who is the CEO of Aga Khan. Kisumu Europe, that is K-E, Kisumu Europe. Karibu sana, Ms. Jane. Let us give us a clap as she comes. Welcome, karibu Jane.
For the distinguished guests in the room, my colleagues, ladies and gentlemen, and all protocols observed, good evening again. So I consider it a very great honor that I'm and I'm truly humbled to deliver the keynote address to this important gathering. But it's more humbling for me to be honored to address a gathering like this, where I truly know that I have people in the room that I call my mentors, that I call my seniors, that I call my leaders in other forums. I'm actually excited. I didn't know that I'd be able to meet my chairman in this place, Mr. Collins. I'm humbled. Thank you. I like introducing myself, and I'm glad that I wasn't introduced as I wanted. It's because I like introducing myself the way I like introducing myself. I like introducing myself anywhere that I go, that I am Jane Wanyama. I'm a Kenya registered trained nurse from the famous mother of all Kenya Medical Training College, Nairobi, where I did my general nursing. And in that college, after I was done, I went to Busia District Hospital. Fast forward, I joined Pumwani School of Midwifery, where I came through as a distinction midwife. And I feel nice about it. The reason why I feel nice about it is because I am what I am today, with whatever titles I may hold, because of the backbone of having been a nurse. And I don't take it for granted. So before I declare any other title on myself, I always want to tell anybody that I am a nurse. And I think it's important that for us as nurses, that we are the ones that should be able to stand out for the profession that we have. When we do it that way, like one said, we do not want people, and especially in this era and this time, that many people are asking, I would like my daughter to go and do nursing, or I'd like my son to go and do nursing, for only one reason. Why? Because after they are done with nursing, they'll go to UK or go to US. That's not why we did nursing. Because we did nursing because we wanted to do nursing. Because it was a profession that we wanted to be associated with. So that's Jane. And by God's grace, and I always say it's by God's grace, that today I work at the Aga Khan Hospital, Kisumu, as the CEO of the hospital. It's Kisumu, Aga Khan Kisumu Cluster, as we call it. I thank God for my leadership at the Aga Khan Health Services, that they saw the potential in myself, and they thought that I would be able to do it. And it's been by grace, 5 years going, and much more to happen. I'm actually feel very privileged that a hospital that came up as a maternity nursing home without any master planning and everything. I don't know how many of you were last in Kisumu. We are coming up with a mega building today, a beautiful hospital. It's going to be a beacon in the Western region. Something I'm very proud about, and I thank God for. When I was asked to speak, I had 1,001 things put on my table. And I asked myself, what am I going to speak to these professional, learned nurses? And I remembered, and something that I actually even had to ask Omia when he was here earlier, remind me, what is ECSACON again? And I want to thank you, Omia, that you're saying it's time to start moving. Because there's one challenge that we always face in life, is we conceive, but we don't give birth and make the baby move on. I'm sure the COSEXAs of this world that are partnering with in Aga Khan, for example, the anesthetists have started one that I know I'm partnering with at Aga Khan Hospital in Kisumu, and within the Aga Khan, came way after ECSACON. So really, it is time that ECSACON moved and provided the opportunity to the nurses, not just to present papers, but to be able to train in those special programs, enhance their skills, and get the fellowships in them, and come and impart on healthcare of the communities that we are in. I had to say that even before I get to what I wanted to say, because I know I wasn't going to touch on that. So I was asked to speak about health system strengthening and the role of a nurse. A good health system delivers quality services to all people when and where they need it. The exact configuration of services varies from a country to another. But in all cases, it requires to have a very robust finance mechanism, a well-trained and adequately paid workforce. And I would want to put well-trained, because ECSACON, your role is in that, well-trained. So that is bold and underlined. That backs it with very reliable information. Someone has just talked about us having a lot of information. If you look back in the healthcare industry, if there are people that have information and in loads, is none other than nurses. But what do we do with that knowledge? What do we do with that information? Or are we at that point where we say we are data rich and knowledge poor? And not because we want to be knowledge poor, but because we are not using it to make the changes that we want to see in the healthcare industry that we are working in. Health outcomes are unacceptably low across much of the developing world, and Kenya is also included in that. And the persistence of deep inequities in the health status is a problem from which no country in the world is exempt. At the center of this human crisis is the failure of health systems. Much of the burden of disease can be prevented and cured with non-affordable technologies. The problem usually is getting drugs, vaccines, the information that is required to make decisions or to form prevention and care on provide the treatment on time. There's a lot of issues that nurses on the ground face that really inhibit them from being able to deliver the type of care that they should. It's widely accepted that only through building and strengthening health systems will it be possible to secure better health outcomes. The key question is, what does this mean to our practice? For close to the last 2 decades, the importance of health systems as a part of the global health agenda has been a topic of interest and discussion. To achieve their desired goals, all health systems have to carry out some basic functions, regardless of how they are organized. And I'm sure we all know what these are. They need, 1, to be able to provide the services. 2, you need to be able to develop the health workers and the other key resources. So again, develop the health workers. Have to mobilize and allocate finances. And ensure health system leadership and governance. And these are some of the challenges that we face today. And the reason why our health systems are not as robust as they should be. The World Health Report 2000 defined overall health system outcomes or goals as number 1, improving health and health equity in ways that are responsive, financially fair, and make the best of the most efficient and use of available resources. WHO Health Systems Framework breaks down this into 6 pillars which I think if we had time, I wouldn't have wanted to read them out, and I'm still not going to read them out. It's my hope that the team here actually know those 6 pillars that WHO has been able to define as important for health system strengthening. It is only through building and strengthening health systems that it will be possible to secure better health outcomes worldwide. Irrespective of how a health system is organized, there are some desired attributes for each building block that holds true across all systems. Among them, of course, is health workers. As Mrs. Elizabeth Oyuer said, one thing that we always said, and I still believe is today, that nursing is the heart of healthcare. And if nursing is not right, it doesn't matter the institution, it doesn't matter the facility. I'm sure Musimi, you know what I'm talking about. I'm sure Lydia Nyachiro, you know what I'm talking about. Nursing is the heart of healthcare. So when we see things going wrong, we should actually ask ourselves, what is our role? What is our role? So what is the role of nurses in the health strengthening, in health system strengthening for the future? One of the key indicators of a robust health system is one of attaining health equity. A word that I'm sure we've been hearing so much in the last few years. The decade ahead will test the nation's nurses in new and very complex ways. Nurses live and work at the intersection of health, education, and communities. Nurses work in a wide array of sets and practice at a range of professional levels. They are often the first and the most frequent line of contact with people of all backgrounds and experiences, seeking care, and they represent the largest of the healthcare profession. One of my nurses loves saying this word, that nurses are the ones that are there when a baby is being born and they have to wipe it with that gauze. And the nurse is again the one that will be there when they want to close those eyes. That's a nurse. And so we need to understand where we are positioned in as far as humanity is concerned. So a nation cannot fully thrive until everyone, no matter who they are, where they live, or how much money they make, can live their healthiest possible life. That's health equity. We all know that helping people live in their healthiest life is and has always been the essential role of the nurses. Nurses have a critical role to play in achieving the goal of health equity, but they need robust education. I don't know how many of us here are from, at least I had my teaching, I know there are nurses there. I don't know how many of us are from teaching institutions. How many of us? Yes. You are the ones that are shaping what it is that is expected. We are the ones that support the work environment. We need to have autonomy. And when I asked Omia, so Omia, what are you doing now? He gave me an interesting title that I don't understand. Something parliament, something. And I think if there's anything that we need, is nursing needs not autonomy on papers. Autonomy, obviously, I don't know how to put it. You know that we are autonomy. You know, or you can say it's autonomy, but it's like it's autonomy on paper. We need some autonomy where we don't have to go through other categories of people or professionals to be able to pass our point as nurses. The ultimate goal of HSS requires a strengthened nursing capacity and expertise. By leveraging these attributes, nursing will help to create and contribute comprehensively to equitable public health and healthcare systems that are designed to work for everyone. One of the main drivers of health equity is having the universal health coverage. In Kenya, the UHC was launched in February 2022. Kenya nurses, like all worldwide, will have to play a very vital role in achieving UHC. I don't know how many were involved. I don't know. And remember, the moment at which people are involved, from the point of conception and planning and everything, then you own it. And you can drive with it. You can understand what issues are there. What do we need to do to make sure that it becomes the success that it should be? I am from Kisumu, and in Kisumu, it was one of the counties that we launched UHC. And 1 year after, when we sat back to look at what went wrong or what should have been done, there was the big issue of health financing. My prayer and hope is that we will not go 1 year down the road and say we should have deeply involved the nurses for UHC to succeed. From the perspective of Anne Kennedy, ICN, representing more than 20 million nurses worldwide, considers that health care is a human right for everyone, not just health care, but quality, affordable, timely, and accessible health care. The country or place where a woman lives should not dictate whether she lives or dies because she cannot afford health care or it is not accessible. Neither should a child die from malnutrition or infectious diseases because of where he or she has been born. And it's not a wonder today, if you see what is happening, and specifically for the private sector, that we are all now mushrooming. We are getting into the machinanis, right? Because we understand that that is really where we should be, trying to make healthcare accessible. Of course, with its challenges, because by the time the patient is coming to me, she will have to pay. But if she was a patient that maybe was under the UHC and fully covered, then they may not have to pay for it. But it's possible that they get there, and when they're getting there, yes, they'll find the nurse, but she doesn't have what she requires to be able to provide the care that is required. And that is why it's important that nurses then are involved. Today, we cannot run away from primary health care. Neither can we run away from the fact that we should have a continuum of care that starts from primary health care to secondary health care to tertiary health care. And in all these places, we need nurses to be there. We need nurses with the knowledge that it takes, with the skills that it takes. But also, most important, with the attitude that it takes. So that we can be able to create proper demand and supply for the services that we are offering. And so then, my big question for us who are sitting in this room is, who is better placed to inform health policy, be it in an institution level or at national level? The nurse. The structures that we have in whichever facilities that are there should be able to provide opportunities for nurses to be at the policy development table. So that when the policies are being made, nurses are contributing to them. Globally, we know that we are over about 10 million nurses in the world, and this only means that we are a force to reckon with if we want the world that we want to see and the change that we want to see, and more so equity, because that's our core business. Without nurses, without investing in nurses and improving the conditions of their employment, governments will not retain nurses in the health workforce and therefore never achieve UHC. It's just a fact. When COVID came, there was lockdown of everywhere. Then COVID came down, then skies were opened. If you want to know how many nurses have left for the US, come and ask me. I have like about 50% of my nurses that have left the country for the US. What are we doing? So we've become a training ground for the first world, as they call themselves. So it's important that there's someone that looks out for this nurse. We'll take them for the training. And even when you take them for the training, they'll be ready to buy out the training. I don't know if you understand what I mean by that. So she'll go for nephrology nursing. It is about 250,000. She'll pay you the 250 and take the next flight to US. What are we doing? So we've become a training ground, and a training ground of basic nursing. And the few that are becoming ICU nurses, nephrology nurses, all those specialty nurses are just going. So really something needs to be done if we are going to retain and have what it takes in this country. So again, talking HSS, COVID pandemic in many ways taught us and sent the message home of the vulnerability of our health systems, not only in the world, but also Kenya inclusive. If I'm not wrong, at one point there was even a call of, did you ever work as a nurse? Please just come. Those 87 ones that they were talking about, weren't they called to come and work? And we are speaking UHC. I think we need to sit back and ask ourselves, what do we need to do? It also brought to the limelight the interdependency between the public and the private sector in strengthening health systems. And so when you talk about collaboration, when you talk about integration, when you talk about partnership, when you talk about teamwork, nothing taught us better than COVID pandemic. And so we need to think and ask, what should we do? What policies should we have in place today that can help us only be better if anything like that was to happen again? It is therefore true and goes without saying that WHO vision on health system strengthening cannot be delivered without nurses. It can't. Ladies and gentlemen, allow me to conclude by saying that the need to move towards building a resilient health system together is inevitable. And I take this opportunity to assure you that if we believe in ourselves, we are able to get ourselves in that place where we can influence healthcare systems, not only nationwide, but also worldwide, if we believe in ourselves. And if we believe in ourselves, I actually want to challenge us as nurses. That one thing that is happening today is that we need to embrace things as they are happening. People are speaking stories about themselves. Nurses, we need to go out there and speak stories about ourselves, other than bringing each other down. We need to speak stories about ourselves. The good things that we are doing down there, the good thing that that nurse in Sabatia is doing, those nurses that are serving those PPHs, those stories need to go public. I actually don't know when I last saw JK live interviewing a nurse. I don't know. When did you see? We need to get out and speak stories about nurses and what nurses do and what nurses are capable of and what's in nursing that makes the difference. And more so at times like now when we are thinking UHC. Finally, I again want to thank the organizers of this conference for this opportunity. And on behalf of the Aga Khan Health Services East Africa, I want to assure you of our commitment to being part of the very strong health system through integration, collaboration, and with all other stakeholders, just to see that we can impart and make a difference. And most important, stand up for the nurse. Ladies and gentlemen, nurses, you must be intentional. I want to challenge us. That I'm glad that we're having those papers, but I'm saying we need to be intentional. We need to be intentional about what we want. We need to be very intentional about the future that we want. The future that we want to see about nursing. We are talking about Eswantini. I introduced myself as a nurse midwife. I'll tell you where, for those that have worked with me, will tell you that Jane is a passionate midwife. That even when I am branded the CEO, I sit down on the table and will still talk midwifery. And when I hear that mother crying in the labor ward, I'll run to that labor ward. Do you know where I got it from? South Africa. And these nurses once attended a meeting, their conference there, and the midwives were so passionate, and they were singing, "Until I reach my goal." And I always remember getting back, then I was in Aga Khan, Nairobi. And my chief nurse then is when they just introduced the BSN nursing. And when they introduced the BSN nursing, it was like all nurse leaders or team leaders were supposed to do the BSN. And I remember facing my chief nurse, and trust me, it's the same thing I'll tell her even here today, and she knows it. I told her I wouldn't do BSN. I wouldn't do BSN because I don't want to do BSN. I want to do midwifery. Being sure of what you want and going for it. And when I sat in that class of midwifery, and I sat and finished with UNISA, University of South Africa, today they imparted in me such that I'll see a pregnant woman anywhere, even in the supermarket, and I'll actually talk to her. Not because I want her to come to Aga Khan to deliver in Aga Khan, but just to make sure that she's attending clinic and that she will be ending up deliver somewhere. That's the midwife in Jane. That's the midwife in me. So I'm saying we need to be very intentional. We need to be very passionate about what we are doing as nurses. And if we are not, then who will be for us? Who will go with it for us if we don't do it ourselves? So let's be deliberate and position ourselves, nurses, as the people that are called to spearhead health equity agenda in the world and in Kenya. God bless you.
Thank you very much. Madam Jane, thank you very much. That was a wonderful keynote address, wasn't it? I can see we are almost dozing, so we are almost dancing. We have 1 hour to go. And let us do as the keynote address Jane has said it elaborately to all of us, that the nurse is the heart of the health system. So this will help us strengthen our health systems, and let us all bring our chairs to the table for policy making. So at this point,
Thank you so much. I'll not speak now because time is well spent, but I just want to thank Jane for being very passionate about what she's doing. And it is the truth. She's speaking from her heart. So I'll be calling them, then I give Jane the certificates, and then it can be awarding. And Fred can be in the middle so that you pass the certificates to Jane. So when we call you, just come, and we get the certificates, and we want to get it where the photos can be taken nicely. Oh. So ladies and gentlemen, we want to award our very own senior nurses with a certificate of recognition day of June 2022. First. So we start with Benson Mangera. Let's clap for Benson. Benson, followed by Isabella Mbai. Followed by Rose Samutani. Oh, sorry. Rose to be followed by Grace Omulogoli. Yes. There you are. Yes, that class. Then we'll have Henrietta Hamati. After Henrietta, we have Trudy. Trudy Munyezo. Isabella Waweru. Jackpet Mugo. Then we go to Rosemary Mutua. Polepole daktari achukue foto. Daktari bado. Followed by Lydia Pendo. Now, Fred Obiang will be giving Yen Wanyama. Then Yen Wanyama will be giving Fred
The last in that class, you can guess, isn't it? Elizabeth.
My God is Udo. My God is Udo. No more dabo dabo. Dabo dabo. No care dabo dabo. Dabo dabo. Conmigo dabo dabo. Dabo dabo. Si mama tucheze. Ai 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 ai.
Thank you.